And welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. Our patient is here from Ohio, and he has Piriformis syndrome, which is a torn muscle in the buttock on his right side. He also had 2 herniated discs that were causing 10 out of 10 and 11 out of 10 pain. We just finished fixing those with the Deuk laser disc repair. But let's pull the fluoro back for just a moment. And this way you can see what I'm talking about. The patient is laying on his belly. He's asleep, but he's asleep with twilight sedation. There's no general anesthesia. We just finished the Deuk laser disc repair. It went perfect. We're now going to work on his buttock. How do you know you have piriformis pain? Well, the belt runs here. Okay, this is the butt crack right here. Okay, I'll show you the butt crack. I'm not going to show you the butt crack, but the butt crack is, the top of the butt crack's there, and then the anus is down there. So this is the right butt cheek. This is the inferior gluteal fold. This is the top of the buttock. So the middle of the buttock is right around there, and right here. And the piriformis muscle runs in the top of the buttock, right there. It runs from the sacrum over here, where it attaches, and it runs over, attaches to the top of the hip. People tear their piriformis muscle when they have a pain in their back from a bad disc or something else like a facet, and they're bending and twisting bad. They bend and they twist their hips and they tear the muscle. They get a rip right in the middle. Remember, a big part here, small part here. We're going to go release the muscle. That will take that pain away. Come on in. If you have questions, feel free to ask us. So piriformis release is where the surgeon cuts the tendon of the muscle or cuts the muscle. Most surgeons will cut it in the middle where the sciatic nerve is. You don't need to do that to get rid of the sciatic pain. And wait, let me just check. Is that it there?
Yes, sir.
Oh, wow, perfect, huh? So I need to be a little more medial. Can you rotate the hip a little more? We need to push the knee. Luis, grab the knee. Don't worry about this. Don't worry about this. Okay, just grab the knee. And let's see what we did there, shot. All right, that's pretty darn good. Shot. That's really nice right there. Let me have the knife. I'm going to make a 4 millimeter incision. And we're going to fix this with a 4 millimeter incision. This is a Band-Aid incision. So we're not the first place in the world to do a piriformis release. It's been done for years, but it's done open. Open means big incision, cutting through the gluteus, and very painful, very long recovery, and very bad results, like 50-50 at best. What we're doing here is far less invasive and far more successful. Shot. I need to bring this thing down right to, there it is, right to the greater trochanter, what's called the posterior facet. Okay. By the way, I pioneered this technique here at Deuk Spine to release the piriformis muscle to treat piriformis syndrome, which is a lot of it's sciatic pain, but some of it is not sciatic pain. A lot of it's butt pain. As a matter of fact, if you talk to people with piriformis syndrome, the most common symptom they have is butt pain in the butt. Okay, I got to find this bone again. You got to start right on the bone. This is the key. You must touch the tip of the back of the bone, the greater trochanter, with your probe, and that's going to be where the piriformis attaches. Shot. Should be right there. So you can see the bone curves around to the left. Show us the curve. Yep, that's the posterior. No, the posterior facet goes a little further back. To the left. Keep going. Yes, there. Okay, there. Keep going. Yes. That's all attachment. Okay, and that's where I have to release the muscle. Let's take a look right now. So I'm at the bottom of where we need to release. I need to come back up to the top. The other thing I do is I go down onto the posterior femoral neck, just so I know the depth, right? There it is. We're on the posterior femoral neck, okay? You don't want to go further anterior or forward than that. That's as far as you want to go. but really your working area is above that. I can feel the muscle. I'm releasing it just now. I feel twanging. Let's just see. Hold on. Shot. That's the top of where you want to be. You don't want to be further up than that, like towards the head. But yeah, it's going really well so far. I'm pretty happy with that. Hold on. Yeah, that's pretty damn good. I don't feel any more muscle. We're done. See how quick that is? It's a really quick procedure if you do it minimally invasive. And we pioneered this technology, and actually we're getting it patented, believe it or not. Because I pioneered it and thought about it after studying the anatomy of the muscle. And everyone else releases the muscle here. Big incision, cutting through your gluteus. You have a big scar. It's ugly. You're permanently damaged. You can't do running and stuff. But I figured out a way to do this without damaging muscles through a 4mm incision. What, don't believe me? 4mm. 4mm. Bam. He's going home. 30 minutes, he'll be home. Our first patient already left, right? I mean, he was gone like 45 minutes. So, any questions?
No current questions.
All right, Deuk Piriformis muscle release. That's the name of the procedure. And very common problem, very easy to fix. Let's go ahead and end.